mission of the American Heart Association is to be a relentless force for a world of longer, healthier lives. We work to improve the lives of all Americans every day, but we cannot achieve that goal until we address the issues in inequality in healthcare. Doctors Watkins and Saunders pioneered this work, not only in Baltimore, but nationwide. It was our privilege at the American Heart Association to work alongside them in their efforts, so it's only fitting that we created this award to honor their work.
I first met Dr. Watkins before I came to medical school here in Baltimore. A remarkable man who has done a tremendous amount for African American advancement in academic medicine in this town and in this country. He was the first surgeon to ever implant a defibrillator in a human being, a phenomenal achievement. And he taught us that before we do anything else, we must first be excellent as physicians, excellent as scientists, as researchers, and excellent as teachers.
Eli was someone who was always thinking outside the box, and he wouldn't take no for an answer. In the 70s, Eli was realizing as a cardiologist that a lot of his patients were dying of hypertension-related diseases. He would look at the research and he would see that there were not any people of color being used in the research process. And he stopped and he said, how many people in the African American community have high blood pressure? Well, the answer is a very large number. Why are these new medications not being evaluated with the patients who are going to use them? And he and Dr. Watkins, they used their influence and were able to make a difference. And because of that, people of color, it is mandated that they are to be included in the research process.
To have this honor named for a man like Levi Watkins is entirely appropriate. He was involved with the American Heart Association, and he was also involved with bringing people of color into the community of academic medicine.
Eli was there from the very beginning. He was always very proud of the American Heart Association for having grown to be the entity it is today and to have his name carried forward with Levi's. He was very proud of it, and as a family, to see that his hard work and what he has done for his local community, for Baltimore, Maryland, but also, nationally, we're very pleased.
This award appropriately celebrates people like Elijah Saunders and people like Levi Watkins because their courage is what moves us forward in our effort. We recognize them for the gift that they gave us with their lives and their careers and their courage. And by celebrating their efforts, we end up encouraging others who follow them to continue that effort.
This award honors not only their legacy, but also the work that still needs to be done to address health disparities in this community and all across the country. The Watkins-Saunders Award was created to champion the work not only of Doctors Watkins and Saunders, but also to those who continue to do their work in the community to address those health disparities that still exist and to continue with the mission of the American Heart Association.
I met Barbara probably a few years before my father, Dr. Elijah Saunders, passed. And what I knew about her at that time is that she was a very well-respected cardiologist, was doing a lot with him and some of his colleagues with the International Society for Hypertension in Blacks. Dr. Barbara became my cardiologist after my father passed. And it's worth noting that my father, beyond being my father, was also my cardiologist. And that was intentional because there really was no one else that I would have trusted with my cardiac health than him. Unfortunately, when he passed, truly the only person who came to mind was Dr. Barbara Hutchinson. She was the closest thing to my father in terms of medical care and a cardiologist that I, from afar, would say I respected. I knew that from her workings with him and the type of research she had done, that she would bring to my care the same type of energy, if you will, and commitment to what he stood for, which was making sure the most unrepresented population, which turns out to be people of color and women of color, I knew that I would get the best care from her. I knew that she modeled similar qualities, professional qualities to what he possessed. So there was no one better in my mind that I could go to, that I could trust, and that I would feel comfortable with. And so again, she was a natural choice for me.
So I grew up in a little village in Tobago, that's in the West Indies. And both of my parents were from the same village. And I was just concerned or really curious about the dichotomy that existed in the family. My father's side of the family seemed to have had heart problems, high blood pressure, diabetes, obesity, whereas my mother's side of the family was relatively healthy. So as a child, I always had the curiosity of wanting to know why the difference. Because in my little mind, they were from the same place. They should not have been this wide discrepancy. So that curiosity led me always to want to be a heart specialist. So when I came here, I first went to Howard University, where I did a PhD in cardiovascular pharmacology, because I wanted to do something that would help me in my career path as a cardiovascular specialist. Following that, I went to the University of Maryland in Baltimore, where I did medical school training, residency, and cardiology fellowship. That year that I went, fortunately, it was the year that the University of Maryland took in the most African Americans. So I felt very comfortable during my time there. As a matter of fact, I rose to be the first African American president of a medical school class at the University of Maryland. I recognized the big deal it was after the fact. And if I could be really honest, because at the time I just thought, it's just another, position in the class. But now looking back, I recognize at that particular point in time, it was significant. In the moment, it wasn't any surprise to me because I guess coming from the Caribbean, where I'm not exposed to the same history here. So for me, when I went to medical school, I was the first time I was in a class with so many people that didn't necessarily look like me. But that never bothered me because history is quite different in the Caribbean. So I got along very well with everyone. So when it was time to vote or elect a president, I was elected. I think the proudest moment for me is being able to um, maintain an independent practice. Because, so many of my colleagues, I look around, they started independent and now they have morphed into an organization. So I've been the manager of Chesapeake Cardiac Care since 2006. I'm still proud of that because I've been able to practice the way I was trained and the way I enjoy practicing, where doctors could call me up at 2 a.m. in the morning and just give me a name of a patient and I know the whole history. And that's because of the personal interaction with patients.
One of the hallmarks of being a great physician is not just taking care of patients or doing research, but how you treat your patients and how you reach out to the community to use your talents to make a difference. It's been known for a long time that the community around Dr. Hutchinson loves and supports her, and she loves and supports them. When the Association of Black Cardiologists has done programs in that area, they have always been well attended. Even more importantly, the information has been state-of-the-art, evidence-based, and motivates patients to do better. Besides her expertise as a cardiologist in delivering care, her relationship to the community and to the general population of people, especially those who are disadvantaged, has been one of the hallmarks of her career.
Over the years, I think Dr. Hutchinson, is an extremely smart woman who really has demonstrated an ability to keep up with both the academic and the clinical aspect of cardiovascular medicine. She has done extremely well in her professional life as a private practitioner, as well as a contribution to the Association of Black Cardiologists and to the mission of the ABC in general.
For over 30 years, I've been a part of a group called the Association of Black Cardiologists. I was the president in 2016, 2017, and now I'm the chair of the board of the Association of Black Cardiologists. One of the things that we're actually working on diligently to improve access to care, one, and to increase that pipeline. Access to health care in this country is not where it should be just yet. And unfortunately, the group that's affected most by that are underrepresented minorities. And we really have to work harder at that in ensuring that that group can have access to the cardiovascular care that they need. Along with access also comes workforce, because there are not many minority or African Americans that's, let's say, going into cardiology. So we have to have a way of increasing that pool, because people feel comfortable seeing people that look like them.
I am the chief of cardiology at the Moore School of Medicine, and during Dr. Hutchinson's presidency as the president of the Association of Black Cardiologists, and also working with its co-leader, Dr. Phyllis Sugade, was the chair of the board at that time. They were instrumental, particularly Dr. Hutchinson, in making sure that the Moore School of Medicine cardiovascular program was born.
We work together alongside with Barbara in a suggestion that the fund that the ABC has raised in the past to train fellows in cardiology should be given to one program, so that they can build a program that we will work to continue to grow to train other Black cardiologists. And that award was given to the Moore School of Medicine. And by that, the Moore School of Medicine has become one of the centers where a lot of Black cardiologists are trained. In the past, before I worked with the Moore School of Medicine, they did not have a cardiology fellowship program, but one has since been established, and they've graduated fellows now for almost 4 or 5 years running. And so that workforce issue, I think, became, the most prominent act in my mind, with a suggestion to do that. And we presented to the board together, and the board approved that plan. And it's been a very fruitful experience. And I know that serves as a template for other organizations, or even the ABC, to grow upon.
They provided both financial and emotional support to us as we started the program. And the program is now 8 years into being and has been successful. And I credit Dr. Hutchinson and Dr. Sugade for their support. And I think that goes directly to what Dr. Hutchinson has done as part of tenure as the president of the Association of Black Cardiologists, and as well as the current chair of the board of directors, in terms of supporting workforce diversity. And the Moores Fellowship, Cardiovascular Fellowship Training Program was designed to really meet that demand of contributing to the workforce diversity that we so sorely need for our patients. And of course, that also addresses issues of health equity.
In the African American community, I think one of the things that is missed is the fact that it's a village. And a huge thing is trust. And folks would go to the doctor if they trust the doctor. And trust, unfortunately, comes from people that look like them. But if you have a lot of the providers out there that don't look like me, you could see how people would be very reluctant to go, because they say, you don't look like me and I don't trust you. And so that's one of the barriers we have to overcome. And that's why this whole idea of workforce, getting more African Americans in medicine so that patients could see people that look like them. They feel more comfortable coming, more comfortable talking to them. And so we are starting now in high schools, making high school students aware of the field, getting them interested, exposing them to the field, having them come in, meet doctors that look like them, so they know that that's an option for them. So that's one thing that we're doing. And in terms of the residents, we're working with the residents. Of course, we have cardiology fellows in the ABC, but that's a big priority for us, increasing the pipeline of cardiovascular specialists that could be available to members of the population.
Dr. Barbara Hutchinson was one of the first people to welcome me into the field of cardiology as a fellow in the Association of Black Cardiologists. It was really at a time when I was very much in need of a real life example, and she was exactly that, a living example of clinical excellence and a heart of service for her community. She's built a practice that has touched countless lives, and she's been a constant champion for trainees and those in early career developing their practice acumen.
Dr. Hutchinson really came into my life during my cardiology fellowship at Georgetown University MedStar Washington Hospital Center. As you can imagine, cardiology fellowship is stressful and it's busy and it's overwhelming, but Dr. Hutchinson was a wonderful listening and sounding board for me, and just a pillar of support as I was going through my training. We actually met at the Association of Black Cardiology event, one of the national conferences in DC. And that conference was wonderful in a sense of, bringing together all of these influential cardiologists who look like me. And that was a wonderful space where I got the opportunity to meet Dr. Hutchinson. And since then, she's been just so supportive in my career, helping me grow and, now becoming an attending cardiologist.
Even with how busy she is, she's always able to share a story or a memory that leaves you with a lesson on how best to navigate whatever it is that you're going through. And it's always expressed with such elegance and grace.
Dr. Hutchinson has been a wonderful support of my interest in pursuing advanced training in cardiology. But beyond that, I'm also really interested in innovation. And I run a health equity company called Equity Commons, where we train providers on implicit bias using virtual reality. And since Dr. Hutchinson has known that, she's just been a wonderful advocate of my career. She's brought me into rooms where I never would have thought I would have been. She's put me in front of people who I never would have thought, I would have had the opportunity to liaise with. And all of these things have been because of Dr. Hutchinson.
Dr. Hutchinson, she certainly has an ear to what fellows and trainees have voiced as things that they need to help them in career. She's someone who has checked on me periodically as I moved from fellow to faculty, and has always kind of opened her arms and opened her doors to those who are new to building a practice and mentored them.
My appreciation of Dr. Hutchinson is not just because of her career and all the things that she does, but I appreciate her because she also does work in my hometown. Her office, and oftentimes where she treats and sees patients, is in Prince George's County, where I live, I grew up, my family is from. And so she would be the cardiologist that would take care of my family, my relatives, and the people I love in my community. And so, I love her because of that. I love her for her dedication to that community, her dedication to improving the quality of care that people of color receive in this country. Her research has always been sort of centered and focused around improving and creating equitable spaces for cardiovascular health in this country. I love her for the work that she does because of that. And then she's been this sort of amazing example of what a career in cardiology can look like for a person of color in this country. She's just been this wonderful example of that for me, as I've grown.
A signature program that we have as part of the ABC, Spirit of the Heart, where we go to cities around the country, really taking that whole message of heart disease, screening for different diseases, whether it's peripheral vascular disease or other cardiovascular diseases. So that's something that we're doing as part of the programming.
One of the things that Dr. Hutchinson has done is had multiple interventions in which she not only screens, but educates, leading the patients to understand their disease process. The Association of Black Cardiologists has had, for instance, the Spirit of the Heart, where an entire weekend is dedicated to the people in the community learning more about cardiovascular disease, how to recognize when their risk factors are uncontrolled, and empowering them to take action. Some of the more successful programs that have been done in community interventions have been done right in the community around Dr. Hutchinson's practice. She not only sees patients in the clinic, but has educated patients in outpatient settings, including churches and community centers, about cardiovascular risk reduction and what should be done once you learn that your blood pressure is not controlled, your cholesterol is elevated, and your glucose is not at ideal level.
You know, what I'm struck by is really what I would call her dynamism, her energy. She just does so much. She's in so many different things. And, you know, looking at it, you might think it's a bit scattered, right? She's here working with children. She's here working in nursing homes. She's out in the community. She has her own, you know, practice. She's gotten into this kind of telehealth international thing, and it looks a bit scattered, except it does have a real focus. It's all of that energy is centered around healthcare, cardiac health, and the health of individuals and communities in general. I think it's just quite a remarkable, amazing achievement that she's been able to accumulate over the course of her career thus far. I'm a big fan.
We have been very fortunate in the Association of Black Cardiologists to have Dr. Hutchinson as one of our leaders. She's always turned us to do right, to service the community, and to make sure that whatever we do is evidence-based and we put our best foot forward in order to service that community.
Dr. Barbara Hutchinson, better known as Barbara to me, I am so honored to be able to bring congratulatory greetings to you on receiving this Watkins-Saunders Award. As you know, we've known each other for a long time through our ABC, Association of Black Cardiologists connections, and I actually view you as a role model, not only to the thousands of people who you influence, but also to myself. As the third, female president of the Association of Black Cardiologists, I watch you navigate really important and delicate situations as president, and then now as in your role as board chair, you are so graceful and so thoughtful in your approach to representing not just only the ABC, but cardiology, as well as the American Heart Association, from whom you are receiving this award. As president of the Association of Black Cardiologists and president now of the American Heart Association, I feel that it is somebody like yourself whose shoulders, I really stand on as we are all committed towards improving the healthcare of all populations, but also digging in on health equity and the importance of really taking care of the most vulnerable populations. I believe that you embody the values and the principles, around this award from the American Heart Association.
The committee for choosing the Watkins-Saunders Award winner looks for people who epitomize, who embody the characteristics of my late husband, Dr. Elijah Saunders, and Dr. Levi Watkins, of their community commitment, the doctor who demonstrates community commitment, who is dedicated to providing quality care and diminishing health disparities, particularly of people of color. Dr. Hutchinson's biography and the things that she has done really just made her an outstanding candidate and a very natural choice for this award.
Dr. Barbara exemplifies again the exact type of physician that my father was, one who was just vested and really believed that his research and treatment would make a difference for the better. And the continuation of his research and again how he put his life's work into understanding, why there are higher incidents of hypertension in people of color. I know that that's very important to Barbara, and she's taken it to even another level in terms of women. Why do women tend to sometimes go untreated for such a long time? Why do women die, at the levels that they do from cardiac disease? So again, I think there's no better person, no better physician than I can think of to receive this award. She's everything that I know, again, my father believed in and worked for.
Dr. Levi Watkins and Dr. Elijah Saunders were pioneers in paving the way to achieving health equity. It is our pleasure to each year select one outstanding pioneer who continues with their work in the community. This year, we could not be more pleased to present this award to Dr. Barbara Hutchinson, the 2023 recipient of the Watkins-Saunders Award. Dr. Hutchinson, congratulations and thank you.
Thank you.
I'd like to personally congratulate the great Dr. Barbara Hutchinson for being awarded the Levi Watkins Elijah Saunders Award. I knew them both personally, and they were leaders in cardiovascular medicine. But even more important, they were great human beings who had that touch where they could reach into the community to educate and to motivate. And that's Barbara Hutchinson, a person who has a knowledge base, a skill base, but a human touch that can reach into the community to motivate and educate.
I want to take this opportunity to really congratulate Dr. Barbara Hutchinson for what I consider a well-deserved recognition by receiving the Watkins-Saunders Award from the American Heart Association for all the work she has done and continues to do in Baltimore, Maryland. This is an example of a career of pragmatic steps to impact health equity and ensuring that all peoples who suffer from cardiovascular disease receive the best quality of care that they deserve at the time that they need it.
Barbara, I know we don't get to spend as much time as certainly I would, and I hope you would think as well together, but I have been keeping tabs of you and your work from afar. I've always been a big fan, and I think the Watkins-Saunders Award from the American Heart Association is really a fitting tribute to the work you've put in to the cause of education and prevention and taking care of people with heart disease. I want to offer you just my heartiest, my biggest congratulations. I think this is very well deserved, and I am just looking forward to what you will continue to be doing.
When I think of Dr. Saunders, whose very heart was for the hearts of Baltimore, and Dr. Watkins, who paved a way so that I could walk through doors and sit at the tables that I presently do, there is no better person to have this award and the namesake of these legends than Dr. Barbara Hutchinson.
Barbara, I'm very proud of you being recognized for this award. I know it's something that the committee that decided to grant you this award, I know they went through a lot of diligent process and I deeply congratulate you. Myself and Paul are very proud of what you have done and how you have encouraged us over the years and the friendship that we've formed. And I know this is a recognition that is well deserved, and I deeply congratulate you.
Levi Watkins, Elijah Saunders, two sort of powerhouses in cardiology. And Dr. Hutchinson, you sit right next to those gentlemen in your career and all the things that you've done. So I'm so proud of you. I'm so thankful for you, and all the well wishes and congratulations for this award.
I can say a lot more about you, Barbara, but I, again, am so thrilled on behalf of the American Heart Association's National Board to be able to bring you these congratulatory remarks. And I want to say,
Barbara, I'm so happy for you. You're so well deserving of this award, and particularly in my dad and Levi's honor, I wish you all the best.
She's a really wonderful person. I think above, all else, just really a heart of gold.
Today I am honored and indeed humbled to be receiving the Watkins-Saunders Award from the Baltimore and Greater Maryland Division of the American Heart Association. This award is a highlight in my career. As I think about Dr. Levi Watkins, he was a trailblazer and someone who says, you can do it too. He was the first African American chief resident in cardiac surgery at Johns Hopkins Hospital. I was the first African American chief resident in internal medicine at the University of Maryland. What in fact he was saying is, if there is a table of chief residents anywhere in the country, there is a seat for you as an African American. His research efforts now allow us to treat patients with heart failure with a class of drugs called angiotensin receptor blockers. Dr. Saunders was my beacon at University of Maryland. He was the first Black cardiologist in Maryland. As I pursued my training, he was always concerned about my progress and ensure there were no roadblocks. He led the Division of Hypertension and engaged in research that included African Americans, and he was able to show that some drugs work best in African Americans, who are often plagued more by the ravages of hypertension. Despite his efforts, there is still less than 5% African Americans enrolled in clinical trials today in the US, so there is still work to be done. Both Dr. Saunders and Dr. Watkins were members of the Association of Black Cardiologists, an organization that I have been a member of since a medical student. I have held many positions, including president and now chair of the board. I have learned the importance of community engagement, education, and the need for a collective effort as we seek to achieve health equity for all. Thank you again for this award.